introduce our, oops, I said that too quickly. Do you want to introduce our guest from Healthy Connect?
Sure. Sorry.
I didn't mean to pick on the spot.
No, that's okay. That's okay. Yeah. We asked the ladies to come on from Healthy Connect. So Healthy Connect is our health information exchange in Alaska, and they're going to talk to us about what's possible with Healthy Connect and looking at your Z codes. If I know some people are challenged with their EHRs and not able to get reports easily, so this is another potential way to do that. So we have Carlin and Mary on. I'm not sure which one's going to talk, so I'll just hand it over to you guys because you can explain it way better than me.
Yeah, I'll just go ahead and get started. I'm Carlin. I work with Healthy Connect as their director of clinical informatics. And then I also work as a family practice and detox PA outpatient. So thanks for having me here today. I was hoping to just do a little kind of recap of who we are to give it some context, and then talk about some data and some potential solutions, and then answer any questions that you guys might have. So let me figure, oh, there we go. There's the share screen button. This isn't my, Zoom is not my home platform, so bear with me.
That's how we feel when we go into Teams.
Okay, great. Well, so you'll have grace for me. I realized as soon as I popped up, I was like, oh my goodness, my closet is open and everyone can see my washer and dryer in my home office because my screen's not automatically blurred. So I'm not going to do death by PowerPoint, but I did just want to go ahead and have some talking points up because it helps me. So we're Healthy Connect, the state designated health information exchange. And let's see if I can get my computer to work. There we go. We were created in 2009 by an active legislator. I hate that word, legislature. We have a local diverse board. We're neutral stewards of data. We are guided by Alaska specific needs. And we're moving into more of a role of a health data utility, helping folks move data from point A to point B, as well as the cost-free access to view outside health records. I don't have a current list up of all of our participants, but I'm happy to get all of you that up-to-date, ever-changing list of those who share their data with the Health Information Exchange. We've also partnered with an affiliate of National HIE so that we're leveraging existing technology, so we're not reinventing the wheel every time that there's a new and cool use case or technology out there. Oh gosh, I just jump into things. I also have Mary Eckert, who's my counterpart here at the HIE, and her credentials are very similar to mine. But Mary, if you're still on screen, at least give us a little wave here.
Hi everyone, I'm Mary. I'm based out in Palmer.
Oh, okay.
Here to chat today.
Okay, great. Sorry about that. So just some of our core services, like I talked about, we provide that point of care access to records. We provide list of alerts or events, things that have happened on your known patients to help proactively care manage. On the outpatient family medicine side, this is particularly, I think, fun for you guys to learn about what's happening to your data that gets sent to the HIE. It can then be sent over to the primary care home for hospital discharges so that they can follow up, get them in a timely manner. We have information on opiate overdoses, and then there's a whole plethora of customizable alerts. For example, if a practice was interested in knowing all of their patients who had an A1C over 9 at any lab or organization that contributes data in Alaska, they can get that information hand delivered to them. When I say hand delivered, I mean in an electronic actionable format. These are just some general kind of clinical and operational benefits. So avoiding duplicative testing, care coordination, some of the things that we just talked about. And go ahead and stop me if you have any questions as I'm blazing through this PowerPoint. We kind of serve as the security hub to provide rapid expansion. So for like COVID reporting, when that rolled out, we worked with the state to provide electronic means to transmit COVID test results to the state. And we support the minimal data set ACAMS interface with the Department of Health for grantees that have to supply that data to the state of Alaska. We're also always available to hear about any new projects or data needs that are facing Alaskans in healthcare. And we do offer interface onboarding, technical support, and data quality review. This is more geared for kind of the outpatient care management aspect of how you can receive data. This is a quick just snapshot of what the health information exchange looks like if a viewer logged into the web-based portal. And a lot of electronic medical records, this can be launched from inside a patient chart. So if I was in Anna Cadence chart in Athena, I could click on the button and it would pop up all of the lab, radiology, clinical results, and some other clinical documents as well, so that can be viewed at the point of care. And then this is just our contact information. But what I really wanted to go over today was kind of some of the opportunities for what Kristen had alluded to, the difficulty sometimes extracting or viewing your own data once it's been put into your electronic medical record. We don't all have like the Cadillac version of Epic that can easily do that for us. And so there are some tools available in the Health Information Exchange. They were designed for more of a care management aspect, but they can be really handy in looking at some of your own information. So I'm just going to go ahead and pull up this test data list of things. So I apologize that it says silly things like coconut demo. But this is that tool that can really provide that information back to you if you're having trouble extracting your own social drivers of health Z codes specifically, or really anything that you wanted to see. So inside this tool, you can create filters that will show you a list of the last 180 days of everybody who meets that criteria that's on your known patient panel. In order to be able to view this list, you have to be sharing data with the HIE. So this is only available to organizations that send us data so we know who their patients are. But we can also create it multiple ways for anybody who wants to participate and receive this. It can be downloaded into a Excel file or CSV so that your system can ingest it, or it can be read only. It will tell you the name, the event, where it was, and then it will include any of those diagnosis codes. So this is the hospital admit and discharge list for if I was working at an outpatient clinic and I wanted to do follow-up on all hospital ER inpatient and ER visit discharges. I could populate this list, turn it into an Excel spreadsheet, and kind of work through calling all those folks for follow-up. In this case, it would be more applicable to say, if you needed to know how many Z codes were recorded in your electronic medical record in the last 180 days, we could filter this by Z codes, turn it into an Excel spreadsheet, and you could tally it that way, and then sort your information on that Excel spreadsheet by Z code or however you needed to break that down. Something interesting, let me see if I can pull it up, is this is a overview of the current HIE repository and what Z codes, the sheer number of Z codes that have been received with their corresponding diagnosis. This is across the entire, all data contributors. So the value of entering specific Z codes becomes readily apparent when you look at the top diagnosis for social drivers of health is other specified personal risk factors not elsewhere classified. 30,000 of them. So this is a social driver of health identified need that they couldn't either fit into a bucket, or this was on their quick pick list. So what you put into the electronic medical record starts to really matter when you're trying to answer those big questions about what your patient population, what they're facing. So this was just a quick overview of what lives in the Health Information Exchange repository right now. Something interesting that we're working on is, and I think that this is important for you guys to know as you're doing all this hard work to start capturing Z codes and entering them for your own population management. We're also working with rolling out a pilot project with a clinic in Wasilla to deliver the Z codes back to their social drivers of health worker so that she can perform outreach and make sure that these folks aren't falling through the cracks. So sometimes somebody gets identified with a social driver of health in the emergency room, but they can't be resourced at that time, or the emergency room staff doesn't have the time or ability to provide these resources. There's follow-up on that outpatient side through the primary care home. I think it's important to note that it gets delivered back to the primary care home based on if they're a known patient. So those are some of the things that we're working on. I think social drivers of health has been more than just a buzzword. We've been doing a lot of great work. It sounds like you guys are doing a ton of really great work around social drivers of health and Z codes on a national level. There's a lot of things happening and moving. And so I just wanted to share with everybody here that there is some opportunity with the Health Information Exchange to receive that Z code data back on your own patients if that's problematic for you guys, as well as just let you know who we are and that we're here and happy to help if you have any health data utility needs or data gaps that you're really struggling with. We're always here to help. Let's see, I'm going to turn off my screen for a minute. I'm going to stop sharing so that I can see everybody. I know I kind of just blew through all of that. My primary goal was just to let you know that we exist and that we're here to support any data needs that you guys have as far as either getting your own data back or viewing other data and answer any questions that you might have.
Hi, this is Jeanette. I'm at Bartlett Hospital in Juneau. Thank you for your presentation. And I was trying to see if Deb is still on. Oh, she is still on. I don't know if so Deb's in quality. I'm in director of case management. I don't know if we already get the data, like do we automatically get that or do we request that from you like you were just showing?
So that's a great question. You don't automatically get the data. There are two ways to view that data. One, you can log into the HIE and look at your list of known patients once we've set that up for you. Or we can automate a CSV or a file to come to you on a regular cadence based on the criteria that you set. So if you want a file of all your SDOH identified known patients, we can get that to you on a regular cadence. If you want a file of there's so many limitless options for criteria.
No, I think that's great. I would like to talk with Deb, who is still on, and just think about that. And then we would just contact you to say, hey, well, this is what we're thinking. Can we get this, report every month or every quarter or whatever it is?
Yeah, absolutely.
With this detail. And then thank you. That's amazing. And then another question I have is, so that information goes back to primary care clinics if they're a known patient. Do you know of any primary care clinics that are already using that information to address health-related social needs?
So we're rolling out a pilot that will start on December 27th. We're starting small to see kind of what that looks like, get a feel for what the resourcing issues are on a smaller basis before we start rolling this out, because actionable data is only actionable if there's resources to pass folks onto. So we're working with Connect Matsu and then at FQHC in Wasilla to roll this out on a smaller basis, kind of work through any of the glitches, look at data gaps as far as is this identifying a majority of the social drivers of health that are being recorded by hospitals primarily, and kind of sort through that. We're partnering with the state of Alaska on this And we're gonna look through that, kind of the results of the pilot before we push it out on a broader scale, but it's certainly available to other clinics right now in that filterable tool.
Okay, yeah, because it would be, I think in some clinics, it would be, sort of creating either a workflow or even a position of addressing that sort of thing that, may not exist at this time. So I think it's great, but
I think the long-term goal is to create more partnerships with primary care homes and some of these organizations that are already resourcing individuals and kind of marry those things together. So there's a bigger safety net, a better umbrella, and that everybody who's already doing this work, maybe a little bit in a silo, that we're helping bring those people together.
Great. Thank you.
Yeah, of course. Any other questions that I can answer? I kind of talk fast and go through things fast. I like to call it efficient, but other people don't always enjoy the speed at which I go through things. So please don't hesitate to ask any questions. And if there are additional questions that come up afterwards, or you have questions about your guys' own organizations and what type of data you send, and if this is feasible, I'm just going to put our contact information in the chat so you have a direct line to both myself and Mary, and you can always reach out at any time.
Carlin, I had just one quick question. I know you said that you're able to get into Healthy Connect and then search your patient list to see if anyone has visited the ER. Can you set up notifications like you were talking about so that if your patient is seen in the ER, you'll be notified?
Absolutely. So the way that those get delivered is typically in a Move It folder. So it would be, or a direct secure messaging, it would be, you could either receive that daily, weekly, monthly, but yes, that can be automated as well.
Thank you.
Yeah, absolutely. And I should have led with the caveat that if you're not currently participating with Healthy Connect, and you're interested in being able to view this information on your patient, there is a participation agreement with all of the legalese and HIPAA responsibilities on both party sides. But it is definitely possible, even if you're not sharing data, to be able to sign up with Healthy Connect, submit a patient panel so we know who your people are, and then provide you those same services and level of access. It doesn't require an electronic data share or connection. I know that that's a concern for some folks, and so I just wanted to let you know there's still opportunity to receive alerts and notifications if you're not fully contributing data.
Harlan, this is Dina Jackson at Bristol Bay Area Health Corporation. When you say share a patient list or profile, do you have to have patient names and dates of birth? Or if I said, that's not extremely helpful for like a tribal health organization that we're looking for our beneficiaries in our region? Because that would be like almost 6,000 and some odd patients. That's a long list.
That is a long list. So Cerner should be able to generate the list for you. I think so. There is some other like individual conversations that could be had around looking at like zip codes or alternate methodology. But really, in order for us to know who your patients are, we need first name, last name, date of birth, and then whatever address you have on file for them. Typically, the IT department just runs that list into a Excel spreadsheet. I don't pretend to know how to do that. I'm limited on running back-end EMR reports.
Could we have a conversation possibly about villages and zip codes versus individual patient names and dates of birth? Because if we're looking to do social determinants of health information for our region, because that would be our interest, right? We're doing prepare forms and collecting data in our facilities. But if I would like to pull in some data, across the region, right? Not necessarily collected at our facilities. So then if we're looking region specific, because our patients also receive care in Anchorage, or elsewhere. And so I don't need to know all the care that they receive across the state, but I would be interested in knowing the Z code information, right? Because that pertains then to our region, and having that information.
So it would keep it regional with a patient roster with your known patients, because it would only give you Z code data that's been collected on those patients.
Okay.
In full disclosure, I started out as a health aide in NACNIC, so I'm fairly familiar with that region specifically.
Okay, well, this might take a little bit more than, I've already sent an email out to our CIO, and it will take some conversation about if this would be a direction we would want to go, and then how we would go about it. So I appreciate it. Thank you.
Yeah, no, absolutely. Of course. I think there's like the sub-regional clinic in NACNIC specifically shares information with the HIE, and there's some, of course, Anchorage service area places that I think would capture some of this data for you guys as well. We're here to help. There's no pressure. So absolutely, just you just let us know how and where we can assist, and we're happy to work through that.
Thank you.
Thank you so much. Anyone have any other questions for Carlin or Mary? We did record this, so if you need to hear it again, you'll have the link soon, so you can listen to it. You can slow it down. So you were fine, Carlin. I appreciate you guys coming on. I think this is just another kind of different way of looking at it, another option that might be helpful to some facilities. So I thought it was good for you guys to come and share this possibility with us, and then also for people to learn a little bit about the HIE and how it works in Alaska. I think it's a great resource that we're not all utilizing yet. So thanks. Do you guys have anything else for closing comments you want to say, Carlin or Mary?
No, thank you so much for having us, and don't hesitate to reach out if there's any questions or anything comes up in the future. Like I said, we're here to support. So by all means, reach out and let us know how we can help.
Thank you. I think we're all set. Debbie, do you have anything else you want to throw in?
No? Close us off.
Awesome. So we're done a few minutes early. Well, I hope everyone has a great rest of your December, and we'll be doing another meeting with Natalie in February. That's the plan. So thank you, everyone.
Everyone.
Thank you so much.
And we'll send all the slides out from both presentations.
Thank you.
Thank you.
Thanks, everyone.